Like any medical illness, depression comes with a host of technical names and descriptions. This glossary can help you understand the terminology and the many aspects of depression diagnosis and treatment. Antidepressants. These are medications prescribed to prevent or alleviate depression symptoms. Drugs include tricyclic antidepressants, TCAs, monoamine oxidase inhibitors, MAOIs, and selective serotonin reuptake inhibitors, SSRIs, among others. Bipolar disorder, previously referred to as manic depression, periods of depression alternate with times of mania, excitability, increased energy, and impulsiveness in this mental health condition. There are several subtypes of bipolar disorder. Cognitive behavioral therapy, a type of therapy designed around the idea that reactions, both emotional and behavioral, have been learned. The desired outcome of this treatment is to unlearn previous behavior and incorporate a new method of reacting. Deep brain stimulation. This is a highly experimental depression treatment during which surgically implanted electrodes stimulate the brain. Depression, also known as clinical depression, this mental illness is characterized by intense feelings of sadness and withdrawal experienced almost every day, often all day long, for at least 2 weeks. Dysthymic disorder, a milder yet longer-lasting form of depression, it goes on for at least 2 years, sometimes much longer. Electroconvulsive therapy, ECT, also called electroshock and electroshock therapy, ECT is the purposeful induction of seizures by running electric current to the brain through electrodes. It can be used to treat severe depression. Major depressive disorder, a disabling form of depression that prevents you from carrying on with your normal daily life. Monoamine oxidase inhibitors, MAOIs, typically the last choice among the various categories of antidepressant medications. While they usually work, the side effects can be serious. Precautions include following strict dietary restrictions. Norepinephrine and dopamine reuptake inhibitors, NDRIs, a common type of antidepressant. Postpartum depression, depression experienced by a woman after giving birth. Postpartum depression can occur anytime from delivery through the following year, though it is most common in the first 4 weeks after birth. Psychotherapy, a type of professional treatment that can include psychoanalysis, group therapy, or behavioral therapy. Goals focus on better communication of conflicts and more insight into individual issues and struggles. Seasonal affective disorder, SAD, a type of depression triggered by the seasons, usually winter. Suspected causes include issues related to reduced sunlight, body temperature, and hormone regulation. Selective serotonin reuptake inhibitors, SSRIs, a type of antidepressant medication that works to keep serotonin in the brain longer by preventing its reabsorption by neurons. Well-known SSRIs include fluoxetine, Prozac, sertraline, Zoloft, paroxetine, Paxil, citalopram, Celexa, and escitalopram, Lexapro. SSRIs are often the first choice in drug treatment because their side effects are not as serious as those of other drug classes. Serotonin, a neurotransmitter that plays a role in sleep, depression, and memory, among other functions. Serotonin and norepinephrine reuptake inhibitors, SNRIs, antidepressants that increase the brain levels of both serotonin and norepinephrine, another neurotransmitter linked to depression. Venlafaxine, Effexor, and duloxetine, Cymbalta, are examples of SNRIs. St. John's wort, also known by its scientific name Hypericum perforatum, this herb is commonly used in Europe to help mild to moderate depression. In the United States, the National Institute of Mental Health conducted a trial to test its effectiveness on adults with major depression and found it was no more effective than a placebo. St. John's wort can also interfere with other medications, so always check with your doctor before trying it. Transcranial magnetic stimulation, TMS. This non-traditional treatment for depression uses an electromagnetic coil placed near the forehead to create an electrical current, the idea being that magnetic fields may alter brain activity. Tricyclic antidepressants, TCAs, another type of antidepressant medication. These are older than SSRIs and are usually not the first choice for treatment because they carry more serious side effects. Vagus nerve stimulation, VNS, a type of treatment for major depression used when traditional methods have failed. It involves a pulse generator surgically implanted in the brain that gives off electrical impulses.